Pain is one of the most common reasons patients visit physicians' offices today. And since 1993, the physicians at Non-Surgical Orthopedics have been treating both acute and chronic pain. Our approach to treating pain starts the minute our patients walk in the front door. We evaluate them by taking a very thorough history, including what caused their pain, how long they've had pain, and more importantly, what kind of things they've done in the past to try to treat their pain. Once we've come up with a tentative diagnosis, we can use a variety of different types of diagnostic tests to help us correlate our findings. Since our practice is non-surgical, we like to take a conservative approach and start with the most conservative options available. Oftentimes we'll use medications including non-steroidal anti-inflammatory drugs, skeletal muscle relaxants, and sometimes opioid analgesics to help control the pain. In addition to medications, we'd like to look at more of a holistic approach and consider whether physical therapy or other types of therapy may be helpful. This can include massage therapy, acupuncture, physical and occupational therapy, and other types of modalities, both passive and active, that may help the patient get back to their normal activities and strengthen the core musculature that's promoting their pain. Physical therapy can include passive modalities like ultrasound, electrical stim, and really advance up to exercises and strengthening and preventative exercises for both ergonomics, core stabilization, and implementing a home exercise program the patients can continue to do to prevent the recurrence of their symptoms. Often we'll consider doing different types of injections depending upon the location of the pain. For example, somebody with acute or chronic elbow pain that doesn't respond to therapy and medications, we may try injecting some corticosteroid into the elbow. The same goes for the knee, the shoulder, the hip, other joints in the body, and it's true as well for low back and neck pain. We have a lot of different types of injections we can do that are really focused on the spine. These include lumbar or cervical epidural steroid injections, facet injections, radiofrequency lesioning, sacroiliac joint injections, and a variety of other types of spine procedures that we're able to do here at Non-Surgical Orthopedics. In addition to doing corticosteroid injections in the office, we also specialize in more advanced injection procedures for osteoarthritis and other painful conditions. For example, we do a lot of cartilage regenerative injections utilizing a variety of HA compounds. We also specialize in prolotherapy and PRP, also known as platelet-rich plasma injections, where we're using the body's own stem cells to help regenerate that tissue, regenerate that growth, and heal that particular joint or ligament. Muscle spasm is also a very painful condition and can cause persistent chronic pain in the neck, back, or other regions of the body. In that case, we often employ trigger point injections, which is a local anesthetic which is injected into the trigger point for painful muscle spasm. That almost always alleviates the pain. However, in some cases where patients have persistent pain or it continues to recur after trigger point injections, or in a case where a patient has chronic headaches, we use Botox injections to help alleviate that chronic pain, the chronic headaches, and the chronic muscle spasm. At Non-Surgical Orthopedics, we take pain management very seriously. We want to find out the cause of the pain and do everything we possibly can to prevent pain and reduce pain so our patients can return and live as much of a pain-free life as possible.